Good evening, everyone. Kindly put the message in the final group that we are starting the class. Anyone? Put the message? Anyone has put the message? Okay. Fine. So we can see the ear. This is the part of the ear which is called tragus. ये हमारे कान का वो भाग है, इसे हम कहते हैं ट्रैगस और शॉर्टकट में कहते हैं टीजी. So this is the tragus or TG. The opposite part, this is the anti-tragus or AT, anti-tragus or AT. And the area in between both, दोनों के बीच का एरिया, इसे हम कहते हैं इंटरट्राजिक नॉच, IT. So tragus, anti-tragus and intertragic notch, IT. Now this tragus can be subdivided in multiple parts. This anti-tragus also can be subdivided in multiple parts. So tragus को भी हम मल्टीपल पार्ट में डिवाइड कर सकते हैं और एंटी ट्रैगस को भी हम मल्टीपल पार्ट्स में डिवाइड कर सकते हैं. So when we divide this tragus in the multiple part, we can divide in 5 parts. So we can divide the tragus in 5 parts. Tragus 1, tragus 2, tragus 3, tragus 4, and the tragus 5. So the upper one part is the tragus 1, then the tragus 2, then the tragus 3, then the tragus 4, and the tragus 5. तो ट्रैगस को हमने 5 भागों में बांटा. Now we can see the central elevated part of the tragus. This is the central elevated part. Here we have tragus 3. The 2 parts are upward and the 2 parts are downward. 2 पार्ट ऊपर है 1 2 और 2 पार्ट नीचे है 4 5. बीच में जो एलिवेटेड पार्ट है वो है 3. So let's talk about this tragus first. Tragus 1, 2, tragus 5. इसके बारे में बात करते हैं. This tragus is the very important part of the ear. ये हमारे कान का बहुत ही महत्वपूर्ण भाग है. So when we are doing the imagination of whole body, जब हम संपूर्ण शरीर का imagination करते हैं, that time we know the lungs are here. The lungs are here. The food pipe are here. This is the food pipe. Sorry, this is the air pipe. Air pipe are here. And the nose will be here. This is the nose. Nose यहाँ पर होगी. So we are breathing from here. Then this breathe is going in the nose, then in the breathing airways, then in both the lungs. तो जब भी हम श्वास लेते हैं तो पहले नाक में जाती है और फिर अंदर जाती है. So this can be considered as a nose. Now, because this part is the very deeply connected with the nose, and this part is very deeply connected with the lungs, so the whole tragus is very deeply connected with the lungs plus respiratory system. So tragus is the part of respiratory system. So the tragus is connected with the lungs, with the respiratory system, even with the skin. तो हमारा जो ट्रैगस है वो लंग से और रेस्पिरेटरी सिस्टम से और स्किन से बहुत ही गहराई से संबंधित है. एक बार की बात हुई कि एक लेडी हमारे पास आई, उसको ल्यूकोडर्मा की प्रॉब्लम थी, उसको व्हाइट स्पॉट की प्रॉब्लम थी. शी वाज सफरिंग विद द व्हाइट स्पॉट और द ल्यूकोडर्मा एंड शी वाज क्राइंग, डू समथिंग, I want to get rid from this problem. Okay. And definitely she was having only 20%, like 20% body part was having leukoderma. केवल शरीर का करीब 20% part में leukoderma था, white spot था. So as per the acupuncture, this tragus is very deeply connected with the skin. This tragus is very deeply connected with the nose. This tragus is very deeply connected with the lungs because it is starting of the respiratory system. So as per the acupuncture, if you do random needling, if you put the needle randomly here, it's a very good for skin and it's very good for lungs. अगर आप ट्रैगस को randomly भी needle करते हो तो भी ये आपकी स्किन के लिए बहुत शानदार है. So for the what treatment I did random needle on the tragus from this outer side and from the inner hidden side, 3-4 needles. And second, I have taken this magical triangle, which include upper liver area, lower spleen area, and central 0 point. I have done this treatment in both the ear. हमने उसको ये treatment दिया दोनों कानों में. So we have taken the magical triangle. We have taken this tragus. And just after 5 to 6 days, we start seeing the difference in the leukoderma. हमने सिर्फ 4-5 सीटिंग के बाद उसकी leukoderma की स्किन में डिफरेंस देखा. Even I was not sure that she will get cure or not, because leukoderma looks like little complicated disease. Then I asked her, okay, let's try. I will try. I don't know. Let me try. Then as per the Dr. Nogier, this is very good for skin. Very good for skin. As per Chinese acupuncture also, this is very good for skin. Why? Because as per the acupuncture, skin means lungs. Lungs means skin. So it's a very good for the nose. If someone is suffering with a blocked nose, polyp in the nose, not having proper smell in the nose, you do the random needling on the tragus. आप tragus को random needling करिए, आप देखोगे the person is having very good results. Just random needling. If you do the random needle on the tragus, it is very good for the smell sensation. It is very good for the nasal polyps. It is very good for the nose blockage. It's very good if someone is not able to breathe properly. इन सब के लिए ये बहुत ही अच्छा काम करता है. Now, a very good information I want to give you now. एक बहुत ही शानदार information अब मैं आपको और देना चाहता हूँ. I want to add a very excellent information. You know which organ of the human body connect with the vitality? हमारे शरीर का वो कौन सा ऑर्गन है जो हमें वाइटलिटी देता है? आपने देखा होगा कई लोग जन्म से ही बड़े एनर्जेटिक होते हैं. जन्म से एक कॉन्स्टिट्यूशन होता है कि एक व्यक्ति जन्म से बड़ा, जब छोटा था बड़ा शैतान था, बड़ा ऊधम मचाता था, खूब खेलता था, खूब एनर्जेटिक था. अभी यंग है, अभी भी एनर्जेटिक. और कुछ लोग ऐसे होते हैं जो जब बचपन में भी थोड़े ढीले ढाले थे, अभी भी ढीले ढाले एनर्जी में. So we have seen many persons, they were very much energetic in the childhood, even in the schools, even in the college. They were very active in the sports activity. And even now they are adults, they are doing their job, their business, they are energetic. And some person were loose by the body, even in the childhood, even today, when they become adult. So we carry some vital energy from the parents. So who is responsible for that vital energy? Whether the heart is responsible, or the kidney is responsible, or the spleen is responsible. Tell me, कौन संबंधित है हमारी इस वाइटल एनर्जी से? किडनी है कि हार्ट है कि स्प्लीन है कि और कोई है? आपको क्या लगता है? क्या कोई व्यक्ति को आप खुद तलवारबाजी सिखाओगे तो महाराणा प्रताप बन जाएगा क्या? वो कुछ जन्म से भी लेके आता है. ओके, it carries something from the birth. It carries something in the horoscope. कुछ तो वो लेके आता है. That essence is stored in kidney. The vital energy is stored in the kidney. So if the parents are strong, then child will be stronger. If the parents are weak, then child will be weaker. So the vital energy is connected with the parents' energy. वाइटल एनर्जी का संबंध किससे है? हमारे पेरेंट की एनर्जी से बहुत है. यही, that's why in the Indian philosophy, in the Indian, we see the Ayurveda. In the Ayurveda it's written, the male and female should not try to have the child on the day of Amavasya, on the day of very auspicious day, because they know the quality of the sperm and the quality of the ovum is matter. It's just not a question of fusion. If the sperm and ovum will fuse, definitely someone will appear. Child, some zygote will become. But if you want a good child, then there should be very perfect constitution of the semen and the ovum, both sperm and ovum. तो मेल और फीमेल के जब सीमम और स्पर्म और ओवम में की ताकत अच्छी होती है तो संतान अच्छी पैदा होती है. इसलिए आयुर्वेद में तो कहा जाता है कि आप संतान उत्पत्ति के पहले शरीर का शोधन करो. Do the purification of body. So now if we look at the ear, So let's see this here. In the ear, body is having the head down position. Okay, head down position. Like this, okay? So in this way, the kidney point will be in the upper side. The stomach point will be in the middle side. And the heart and brain point will be on the lower side. Right? So we can divide the whole body. This is the brain and heart. This is the stomach and this is the kidney. तो हमारे कान में शरीर उल्टा होता है और हमारा ट्रैगस संपूर्ण शरीर को रिप्रेजेंट करता है. तो ट्रैगस के सबसे नीचे ब्रेन होगा, हार्ट होगा, बीच में स्टमक होगा, सबसे ऊपर किडनी होगा. In this way, if you are pressing the uppermost point of the tragus, it is the point of vitality. Vitality. This point has been declared as a point of vitality. अगर आप ट्रैगस की अपर पार्ट को प्रेस करते हो, if you are pressing the upper part of the tragus, this is the point of vitality. So what is the meaning of vitality? If you press this point, it will improve the vitamin, minerals, magnesium, calcium. It will remove the weakness. So this is a very good point for the cancer, for the HIV, for the person having weak constitution, poor constitution, having low energy, poor energy. The patient, those who are very weak, it's a wonderful point. तो जो भी पेशेंट कमजोर है, जिन्हें कैंसर है, जिन्हें HIV है, जिन्हें कोई भी ऐसी बीमारी है जिससे शरीर कमजोर हो चुका है, आप इस पॉइंट को दबाओ. So the uppermost point has been declared a very good point, which is connected with the kidney. So this point is called the point of vitality. इस पॉइंट को हम कहते हैं the point of vitality. Now, if we are coming to the center, so the central point connected with the stomach. That's why it's also connected with the nose, because nose, we can see the stomach meridian is passing from here. Okay, leave that concept. So the middle part is connected with the stomach. So this point is also called hunger point. Hunger point. So this point we are using to control the appetite. So this is the very good point if you want to reduce overweight or the obesity. So the center point has been considered as a point of obesity. तो बीच वाला जो पॉइंट है उसे ओबेसिटी का पॉइंट कंसीडर किया जाता है. क्यों किया जाता है? क्योंकि यह स्टमक का पॉइंट है. And this is the hunger point, the point of appetite control, the point of obesity. If we are coming down, अगर हम सबसे नीचे आते हैं, so this is the point of brain. So the brain who is connected with the tranquilization. So this is the tranquilizer point. So the lowermost point is called the tranquilizer point, who is connected with the brain. And so we can use this point to tranquilize the mind, to tranquilize the brain, to bring peace in the mind, for removing the stress. तो सबसे नीचे का पॉइंट हमारा ट्रैंकुलाइजर पॉइंट कहलाता है. और जब सबसे नीचे वाले पॉइंट को हम सिर्फ दबाते मात्र हैं, तो भी हमारा ब्रेन एकदम रिलैक्स हो जाता है. So in this way, this is the Tragus 1.
Hello.
So this upper part is the tragus 1. The point of vitality. चलो जन्म से ताकत नहीं है तो हम ताकत बढ़ा देंगे, चलिए ठीक है. So this is the point of vitality. The central point is tragus 3. This is the tragus 3. This is the hunger point, appetite control point. So we use it in the obesity. इसे हम obesity में use करते हैं. And the lowermost point is tragus 5. There's a tranquilizer point. So this is connected with the brain. The center point connect with the stomach. The upper point connect with the kidney. Okay. So now this is the tranquilizer point. Just next point to the tranquilizer, that is the tragus 4. Tragus 4. Also the brain point, but this has been considered as a nicotine point. Nicotine is also the part of the brain, nicotine point, which is connected with the dopamine secretion. Nicotine point का मतलब बताइए क्या है? Tranquilizer 4 is the nicotine point. अब मान लो किसी का दिमाग काम, अब जो तंबाकू खाता है उसका क्या होता है? उसका दिमाग काम करना बंद कर देता है, तो तंबाकू खाते ही चालू हो जाता है. आपने देखा होगा जितने भी लोग तंबाकू खाते हैं, जैसे कोई मैकेनिक है, कोई कारपेंटर है, वो अपना काम कर रहा है, उसको भी दिमाग तो लगाना पड़ता है. और जैसे उसका लगा दिमाग थोड़ा कम लग रहा है तो पट से वो पुड़िया खोल के मुंह में डालता है, उसका दिमाग एक्टिव हो जाता है. So nicotine point means as soon as you take the tobacco, as soon as you take the padki, it will release the nicotine. Nicotine will go and release the dopamine. So ultimately, more or less, this point is connected to the dopamine. This point is connected to the brain. ये हमारे dopamine और brain से connected है. This point. This is a tragus 4. तो जब भी आप किसी को डी एडिक्शन का ट्रीटमेंट देना चाहते हो, आप इसे ऐड कर सकते हो. You can also use this point if you want to do the treatment for de-addiction, right? So this was the point of nicotine. Now coming in the upper kidney point once again. अब मैं आपको किडनी पॉइंट के बारे में बताता हूँ फिर से. So this point is the kidney point. So we are not telling it kidney point, that we know this is the kidney point, but the auricular acupuncture, this point has been declared as a vitality point or the tragus 1. अब हम बात करते हैं tragus 2 की. चलिए tragus 2 की बात करते हैं. Now remember one thing. The tragus 2 is connected with the thirst, and thirst also the part of kidney. जब किडनी कमजोर होती है तो प्यास लगती है. Kidney is connected with the thirst. So tragus 2 is connected with the thirst. Tragus 3 already we have discussed. The tragus 3 is connected with hunger. Hunger. Tragus 3 is hunger. Tragus 4 is tragus 4, then the tragus 5. थोड़ा नीचे चले गए, वापस ऊपर जाते हैं. Tragus 4 and the tragus 5. So tragus 4 is the nicotine point and tragus 5 is the tranquilizer point. कितने लोगों को ये सब समझ में आया? How many of you are able to understand and able to correlate? Now, see little more. When we talk about the middle part of the body, जब भी हम middle part of the body की बात करते हैं, let's see this image. Let's see this. So stomach, we are telling in the middle part of the body, which is connected with the hunger and appetite control. जिसका संबंध hunger और appetite control से है. So look at this image. Look at this image. So this is the upper part. Upper part. Middle part. Lower part. Lower part is kidney. So lower part is kidney and thirst. Thirst kidney से आती है. Upper part is tranquilizer and nicotine. Tranquilizer connect to the brain as well as the heart. Tranquilizer and nicotine. Now the middle part connect with the stomach. Middle part is connected with stomach. But middle part also connect with the adrenal gland. Adrenal gland. Adrenal gland is the cap of kidney. It is the cap of the kidney. It is the upper part. So it is coming very near to stomach. Adrenal gland हमारी kidney के पास होती है. तो middle part में ये जो adrenal है. If you see in this is the lower is the kidney and upper is adrenal. This is the kidney and this is the adrenal. So adrenal is in the upper part. So adrenal is coming in the middle part. So जब हम कान की बात करते हैं, so when we talk about the ear, the middle part of the tragus 3 is connected with the stomach as well as the adrenal gland. So it is connected with the appetite control as well as hunger point. ये hunger point, appetite control. Now, the upper part we have already told you, track 1, that is vitality point. Then the lowermost part I already told you, tranquilizer 5, tragus 5, that is tranquilizer point. Then tragus 2, Tragus 2 is the thirst. Then Tragus 4. Tragus 4 is the nicotine. So in this way, we also got adrenal point. Now, what is the importance of adrenal point, which I want to tell you? अब यहाँ पर adrenal point का क्या importance हो जाएगा? So the middle part of the tragus 3 is stomach, but also adrenal. तो बताइए क्या इंपॉर्टेंस होगा? अब हमने कहा कि मिडिल पार्ट एड्रिनल ग्लैंड का पॉइंट है, इससे क्या मतलब है? तो मतलब क्या क्या इंपॉर्टेंस बढ़ गया? व्हाट इज द एक्स्ट्रा इंपॉर्टेंस? अब हम यूज कब करेंगे? In the Ayurveda, this has been told Kutri Marma, Kutri Marma. Why? Why Ayurveda have taken this? Kutri Marma. Kutri Marma means tragus 3 or the adrenal gland point. So this is the wonderful, this is the steroid point. Adrenal gland secreting steroids. So we need steroid in the emergency. So the adrenal gland point is the point of emergency. Whenever you are in the need of emergency, any type of the emergency in the body, you can press the tragus. You can press the tragus 3. अगर कभी कोई व्यक्ति बहुत इमरजेंसी में, जैसे आपको लगे इसकी जान जाने वाली है, बहुत इमरजेंसी, आप ट्रैगस 3 को दबा दीजिए. Sometimes suppose someone eating some food and food is going in the air pipe and breathing is stuck. Then press tragus 3. Suddenly pulse rate high, tragus 3. Suddenly BP high, tragus 3. Anything which is happening suddenly and you need in the emergency, tragus 3. Even you are giving the treatment and patient is telling, doctor, I'm feeling something uneasy. After treatment, I'm feeling giddiness, dizziness. Okay, press tragus 3. So tragus 3 is the very good point. This is the point of adrenal gland. That's why we can use this point during the emergency. क्योंकि यह है बिंदु एड्रिनल ग्लैंड का. हमारे शरीर में जितने भी पॉइंट एड्रिनल ग्लैंड के हैं, चाहे सुजोग में हो, चाहे ऑरिकुलर में हो, चाहे टीसीएम में हो, any point who is belong to adrenal gland, you can use them during emergencies. For example, let's see here. So in the sujok, this is the kidney. Those who are doing practice sujok, this is the kidney. Right, this is the kidney. So we can place this point because the adrenal gland is just cap of the kidney. So we can place here and place in the front side. So this will deal the emergency condition. So any point who is belong to the adrenal gland, that point also will work during the emergency. Any point. पैरों में चले जाओ, पैरों में जो किडनी वन है, पैर के तलवे में किडनी वन है, फूड रिफ्लेक्सोलॉजी के अनुसार वो किडनी है. As per the food reflexology, that is kidney. So wherever a kidney is there, therever adrenal gland will be there. So let's see this image. I would like to show you one image for a clear understanding. Let's see this. Suppose if you see this image, so you see this image. So there's a kidney one, but in the food reflexology, this has been considered as a kidney point, and the upper part is adrenal gland. So wherever kidney is, adrenal gland will be there. So if we press the kidney one, it is the emergency point, right? Why? Because this also having the location of kidney. तो हमारे शरीर में कोई भी पॉइंट, किसी भी सिद्धांत से, किसी भी थ्योरी से अगर वो एड्रिनल ग्लैंड का पॉइंट है, आप उसको प्रेस करके इमरजेंसी कंडीशन को डील कर सकते हो, बिकॉज एड्रिनल ग्लैंड इज द इमरजेंसी ग्लैंड, राइट? सो नाउ So let's see now this. So let's see this image now. So these are the lungs. We have two lungs here, right? This is the air pipe. Then so this is the nose, and the upper is also nose. So upper is called external nose, and this is called internal nose. So tragus 2 is the external nose, and tragus 3 is the internal nose. So tragus 3 is also internal nose. So when we are breathing, first tragus 2, then the tragus 3, then the breath is going inside. So in this way, the tragus 3 having a big territory, tragus 3 के पास कितने सारे पॉइंट हैं? हमने देखा tragus 3 is hunger point, tragus 3 is appetite control point, tragus 3 is adrenal point, so emergency point. Now we are telling tragus 3 is the internal nose point. So just noodle the tragus 3. It will treat multiple organs together. And tragus 2 is the external node. So let's see this. Look at here. Tragus. Tragus 1, tragus 2, tragus 3, tragus 4, tragus 5. Tragus 1 is the vitality. And the thirst. Okay. Sometimes we are keeping thirst in the tragus 1, but it is in the between the tragus 1 and 2. Tragus 2 is the external nose, tragus 3 is the internal nose. Then tragus 3 is also the hunger and the appetite control point and the adrenal gland point. Tragus 4 is the nicotine point, and the tragus 5 is the tranquilizer point. We have seen all. तो tragus में हम देखो कि tragus 1 में हमने vitality point को रखा, thirst को भी रख दिया. Thirst हालांकि tragus 1 और 2 के बीच में आता है, क्योंकि हमने कहा कि किडनी का संबंध वाइटलिटी से है और किडनी का संबंध थर्स्ट से भी है, तो दोनों को चलो ट्रैगस 1 में रख दिया. हालांकि थर्स्ट इन दोनों के बीच में आता है. ट्रैगस 2 का संबंध एक्सटर्नल नोज से, ट्रैगस 3 का इंटरनल नोज से. लेकिन ट्रैगस 3 की हमने और भी बातें की, हंगर पॉइंट, एपेटाइट कंट्रोल पॉइंट, एड्रेनल ग्लैंड पॉइंट, सो वी यूज इन इमरजेंसी. और ट्रैगस के 3 के इतने यूज. ट्रैगस 4 निकोटिन पॉइंट and tragus 5 is the tranquilizer point. So in this way, this is the picture of tragus here. It's a very important part. Tragus is very important part, very much. During the emergency, we stimulate tragus. Clear? So in the deuteronomy of the tragus point, the function of tragus point that we can use in the emergencies. The external nose is here and the internal nose is deeper inside. So someone is having some allergic problem of the nose, we can use both the points, both external nose and the internal nose. So we can divide the tragus in three parts. Upper part of the body, middle part of the body, lower part of the body. The upper part connect to the brain and the heart. The middle part connect to the stomach and the lower part connect to the kidney. So kidney connect with the vitality and thirst. So the tranquilizer 1 has been declared the vitality point and the thirst point. And the tranquilizer 5 is the tragus 5 is the tranquilizer point. This is a tranquilizer point because tranquilizing connect to the brain. And tranquilizer 4 is also the nicotine point. Nicotine also connect with the brain. Now the central part of the tragus 3. Tragus 3 means central. So we are considering the stomach. So it's connected with the appetite control. It's connected with the hunger. It's connected with the adrenal, because if we see the human body, in the upper part we have brain, in the lower part we have kidney, but in the middle part we have adrenal and the stomach both. So this middle part has been considered as a stomach. So it is a hunger point, appetite control point, as well as the adrenal. Adrenal, so we are using it in emergencies. And other thing been regarding the nose, so tragus 2 is the external nose and tragus 3 is the internal nose. So everything is written here. So we can divide tragus 1, tragus 2, tragus 3, tragus 4, tragus 5. Tragus 1 is connected to the kidney. So we're telling it the point of vitality, the point of thirst. The tragus 5 is connected to the brain. So we are telling it the tranquilizer point. Tragus 4 is connected to the brain. So we are telling it nicotine point. Nicotine, who is connected to the brain and secreting the dopamine. Now tragus 2 is the external node. Tragus 3 is the internal node. Now regarding the Tragus 3 is also hunger point, appetite control point, adrenal gland point, emergency point. So this is all about the Tragus 3. तो इस तरह से हमने समझा कि ट्रैगस 5 हमारे ब्रेन को रिप्रेजेंट करता है, इसलिए हमने कहा कि ट्रैंक्विलाइजर पॉइंट है। ट्रैगस 4 निकोटिन पॉइंट है, निकोटिन का संबंध भी ब्रेन से है। और ट्रैगस 1 लोअर पार्ट यानी किडनी को रिप्रेजेंट करता है, इसलिए हमने कहा वाइटलिटी का पॉइंट है या थर्स्ट का पॉइंट है। फिर ट्रैगस 2 को हमने नाक का पॉइंट का, एक्सटर्नल नाक का, बाहर की नाक का। ट्रैगस 3 को इंटरनल नोज का। फिर ट्रैगस 3 के बारे में हमने बताया इतने सारे पॉइंट तो ट्रैगस 3 के, क्योंकि ट्रैगस 3 बीच में आता है, यानी बीच में हमारे शरीर का पेट होता है, स्टमक होता है, एड्रिनल ग्लैंड होती है। तो ट्रैगस 3 एड्रिनल ग्लैंड का पॉइंट है, इसलिए इमरजेंसी में काम करेगा। स्टमक का पॉइंट है तो एपेटाइट कंट्रोल में, यानी भूख को नियंत्रित करने में, हंगर को नियंत्रित करने में, यानी मोटापा के लिए हम ट्रैगस 3 का प्रयोग करेंगे। ओके, so this was the just discussion, right? Clear? Clear? Whether you use seeds or the needle, that's your choice. All are working. Everything will work. सब कुछ काम करता है, सीड्स भी करते हैं, निडल भी करते हैं। तो चलिए आज की क्लास को यहां पर समाप्त करते हैं। लेट्स क्लोज द सेशन टुडे and see you on Friday. Thank you so much. See you on Friday.